Hi, everyone, and thank you so much for joining us tonight. I'm thrilled to be speaking this evening with Dr. Kelly Fradin. Dr. Fradin is a pediatrician, a mom of two, and a passionate advocate for children's health and wellness. She is a graduate of Harvard College and Columbia College of Physicians, and currently the director of pediatrics at the Atria Institute in New York City. She is also the author of an exciting new book that just came out, Advanced Parenting, Advice for Helping Kids Through Diagnoses, Differences, and Mental Health Challenges. I'm a huge fan of your book. I just read it, and I think it provides so much practical advice as well as sort of research-backed information on different experiences that families and children may be having. So, thank you for providing that for all of us. So I'm really happy to have you here. And for those of you who don't know who I am, my name is Erin O'Connor. I'm a developmental psychologist. I'm also the director of the early childhood program at New York University and the chief of education here at Cooper, where through talks like tonight and through online parenting groups and our Instagram, we aim to provide evidence-based information to parents to hopefully calm and, cut out some of the noise out there. So thank you for being here.
Yes, thank you so much for having me. I'm excited to chat.
Well, this is great. I mean, I have a ton of questions for you. People wrote in their questions as well. But before we start, can you just talk a little bit more sort of about yourself and the impetus for the book?
Of course. So, when I was growing up as a child, I was diagnosed with cancer. And I think partially because I went through that experience, I sort of had a different perspective than most pediatricians, because I saw how my diagnosis impacted my whole family, the mental health, the physical health, the marriage, the professional trajectory of my parents. Everything was sort of impacted by my treatment. And for years after, even now, just you can see like the ripples in a pond, the effect that had on our family. And some of it's good, some of it was like I met role models and I learned to be resilient and I was independent, and it helped shape me into like the person I am today. But some of it was bad too and hard. And so when I was a pediatrician, I was always noticing how parents, when you give them a new diagnosis or a new sort of task to attend to facilitate their children's development, they often would, listen and then like leave the office like really wide-eyed, like now your child has a serious food allergy and you're going to have to be vigilant about watching everything they eat for the rest of your life. And they're like, it's like, so I wanted to provide a framework to help parents cope with new information like that and cope with the stress and make a plan and develop a way of communicating with their children and with their other family members, sort of all of the things that come along with a child having a challenge.
Well, I think what was so, what kind of drew me into the book so much too was thinking about for the child themselves, like you were saying, how the impact it has on the family as a whole, and sort of thinking about, at different ages and stages, when you're talking to parents and children about their diagnosis, how do you support parents in supporting their child in a way that they understand maybe the ramifications, but it doesn't feel like it's like this burden on their shoulders, right?
Yes, I think it's really hard because parents, many of us don't spend all day with children, right? Like maybe when we were in our 20s and 30s, we were doing other things and not just hanging out with children. So sometimes we've lost that innate sense that people who spend all day with children have of where they are in their development and what's appropriate and what's not, how to communicate with them. And suddenly when we're their parents, it's like we want to be really fluent in that understanding of what a child is ready for, how complex a message, they can handle and all that sort of thing for everyday communications. But then it's even more like heightened when a child has something serious going on or you want to talk about something really important. But I think the first step to thinking about this is to understand that like there is no certainty. Like even if you were that developmental expert, like you can't always predict how the same message will impact a child. You know, actually the same child, same message, catch them on a different day of the week, it might have a different impact. They might listen in a different way. So I think it does bring parents sometimes a sense of peace to be reminded that there's no just like one right way to communicate with your child about these topics. And that instead of thinking of it as like one big message or one big sit down, we often think about it as an accumulation of like lots of little touch points. You know, so they overhear you talking with your spouse and they learn something. They see the way you look stressed on the phone making an appointment, and they start like they piece these things together. So you want to think about the whole picture of when, you know, the communications that are direct and indirect that your child might kind of like observe during these times, and generally just don't forget that it's their life too, and they do have like a right to know at least a little bit of what's going on. Makes them feel safe.
That's a good point. And, you know, just talking about the indirect, because I feel like we're so, just as parents, right, kind of focused on these direct messages that we're sending. And sometimes it's the indirect that they pick up almost more than the direct. What do you talk, like, what's your advice to parents when, you know, whether it be a child with a complex health issue or a learning difference, you know, sort of how to be self-aware of your own, sort of the messages that you're sending that you might not be implicit, or might be implicit, not explicit. Like kind of getting to know yourself, you know?
Yes, there's a whole section in the book about that, about like understanding what you're bringing to your child's challenge, because our experience, the way we were raised, the biases that we have or the understandings that we have about things will influence the way we parent our children through these moments. And so sometimes when you take a step back and think about that intentionally, it can really help you tease things apart. And one thing that's really common, I'm sure you've observed this too, is perhaps many of the children growing up today, you know, they don't view conditions like anxiety or depression or even autism or developmental delay as having a big stigma attached to them. That they, this generation, in a good way, talks about their feelings more and is more welcoming to people experiencing big feelings or who have neurodiversity. That said, a lot of us as parents didn't grow up that way. So commonly when I have children impacted by these conditions, you know, they tell everybody, and they tell everybody often, and they talk about it because it's like, your hair's brown, like I have autism, great, like let's go. But the parents need time to catch up to that, because that's not like how we were raised. We were raised in a different environment, many of us. So that's just one example, but a lot of times we have these preconceived notions, and those are really important to understand when you're supporting your child and when you're navigating family dynamics, because often the parents maybe have different sets of preconceived notions, and the grandparents, if they're involved, or the babysitter, often have their own sort of biases or way of thinking about things, particularly when it comes to children's discipline or sleep or nutrition. Often just people have their default, like what's normal, what's right, and it's what's right to them. It's not necessarily like the gold North Star, but it causes a lot of conflict when we have differing viewpoints, when we don't just acknowledge that we're coming from a different place.
Yeah, that I liked how you talk about that in your book, and sort of thinking about, especially around mental health, because like you said, like you know, even though there is some stigma attached sometimes to it, I think we have come a long way. But you know, like you write about in your book, how many children, you know, have a mental health concern versus how many actually receive treatment and help for that. And some of the barriers there. So, you know, I was hoping you could talk a little bit more about both the barriers and how you can overcome the barriers if you know, if your child might be, you know, seeking some help in the mental health area.
It's really hard to be a parent and a pediatrician in this way right now because there is a real shortage nationally of qualified, available, and affordable mental health support for children. So I think that is like the single biggest barrier. A lot of people, even when they decide they're ready, they might have trouble finding someone. Um, so it's important to acknowledge that some of it is out of our control. That said, there are alternatives. Sometimes you can get mental health support from your school if they have services there. If you have a pediatrician who is equipped to do mental health work in their clinic, a lot of pediatricians are now doing things like starting medications for mental health conditions if it's necessary while children are waiting, if they're going to go see a psychiatrist or on a wait list for therapy. So those are some of the more practical barriers. I think there are also some theoretical barriers too. I think one of the most important ones is that people often don't believe that talk therapy can work, or that that therapy is evidence-based. But it is a misconception that I think people envision therapy to be like you're lying on a couch talking about your feelings. And mostly for children, what we're doing when we're getting therapy is teaching skills and teaching strategies to better, confront what you're dealing with as a child. Probably the most common techniques fall into that category. And we know through like extensive studies that it does work. It can help anxiety and depression symptoms, OCD symptoms. It can help to control ADHD symptoms, mostly with medication too. But that notion that like there's sometimes this lack of belief in it because it's expensive, it's hard to find, and so I think if you're at all skeptical that it could help, it's going to further dissuade you from trying. But really, it does help, and so I'm often convincing parents of that. And it doesn't necessarily have to be forever either. I mean, people see benefits after 8 weeks of good quality therapy. So I think that's important to be aware of.
Excuse me, I was speaking to a friend of mine who's a therapist, and what she was saying too, that she finds is sometimes, I don't want to say a misconception, but this idea that your feelings of anxiety or whatever you're feeling is just gonna like go away, right? And it's like, no, you're actually learning like the coping skills to handle those emotions at times. And it's not about just, pushing those emotions aside and not feeling them. It's recognizing when they come up and how to cope with them. But sometimes we don't necessarily look at it that way, right? It's more of a, I feel anxious. This is not a good thing. Like I need to not feel this way, but rather it's okay to feel anxious. It's just how we cope with that anxiety that helps so much.
Yes, absolutely. I think sometimes because it's become so mainstream to talk about anxiety and depression, sometimes, instead of using the word worry, children will use the word anxious. And there's like a difference there, right? We all have worries. That's normal. It can be motivating to worry about your test because it'll remind you to practice. But when worries start to get in the way of things, that you want to do otherwise, is when I started recommending that children seek out therapy. And it's an important distinction because it will influence how parents kind of set up a child to think about their emotions. Even children like 3, 4, 5, we have, they're learning their alphabet, they're learning their colors. And as parents, we have to teach them how to learn about their feelings and like what to do about those feelings. And I think it's something that schools have started to interest and partner with us in that work too, social and emotional learning curriculum. And I think it does a lot of good. And I'm very hopeful that it will increase sort of the emotional literacy of the population as a whole and sort of better equip these children, even as they grow into adulthood, to remember some of these skills.
No, it's funny. So I've sort of studied social emotional learning for many years, but I feel like almost like the best, sort of insight into it has been having now a 14-year-old and a 3-year-old and seeing even just the difference in how schools are approaching the idea of emotions and emotional regulation. Seems very different to me now with my 3-year-old than with my 14-year-old. There's definitely seems like more of a recognition of we have a range of emotions. We're not labeling them good or bad. And it seems from, anecdotes, but also from research I've done that it does help children in being able to understand that you have all these different emotions and then what do you do with them, right?
Yes, absolutely. And sometimes it's funny because our children are learning all of this. Sometimes those of us who didn't grow up with these curriculums can kind of learn too. Because I can't tell you how many times when a parent comes to me as a pediatrician and they're struggling, maybe like their kid is like really bad mealtime behavior and pickiness or potty training or sleep, whatever it is, they're struggling with this parenting situation. And sometimes at the bottom of it is distress tolerance, right? Because it's very uncomfortable for a parent to be around a child who is suffering. Child is really having a tantrum, like it feels very uncomfortable for us. But if we can cope with those uncomfortable feelings, we can more effectively show up and say the right things and do the right things, or not say the things that we don't want to do, like not like raise our voices if we lose our temper, or start bribing or threatening or whatever kind of coping mechanisms we use to get out of that situation as soon as possible. So I've actually, because DBT has been sort of trending in the mental health world, I've been learning a lot about those techniques, and one of them, the distress tolerance one, seems particularly helpful for parents.
And I think, it's hard. We're in this kind of murky space, right? Where it's like, we understand, theoretically and research wise that distress tolerance is a good thing. And we're sitting with our children with the emotion, but at the same time, parenting also feels very like public in a way right now, I think. So it's this like, you're on the playground and you want to help your child using all these methods, right? Around co-regulation and everything. But at the same time, sometimes you feel very in the spotlight, right? Because we talk about, which I think is a good thing, but we talk about parenting a lot more now than we used to. So it's like, how do you arm parents with that, sort of strength of, okay, I know what I'm doing is going to help my child in the long run, even though right now it doesn't feel so great that they're having this meltdown at the playground and we're not just like leaping, or, you know what I mean?
Yes, I can very much relate to that, because also it's kind of funny. I was at my daughter is 5, and I was at a party with her over the weekend, like a kid's birthday party, and she was overtired because she had been out all day in the beautiful weather, and towards the end of the party she was just kind of like losing it. And I think most parents have been in that situation of like, oh, I probably shouldn't have kept her out all morning, and like she really needs a nap and she's hungry and tired. And but then when it's like everybody in the preschool class knows that I write a parenting book, and they're like, you're a pediatrician, there's this extra layer of judgment. And it's like, yeah, but you know what? This is normal childhood, and like every moment's not going to be perfect. And participating in the afternoon birthday party is fun too. So I don't know. I think we just need to be a little bit easier on ourselves. And that's one of the coping skills I talk about in the book for parents, is that like positive self-talk, like talking to ourselves like we would talk to our friends, in terms of, it's okay. Like, we talk to our kids so much over their lives that sometimes we're going to say the wrong thing. And it's because like we're learning and we're new to parenting, and we're going to get it with time. But that grace that we would give other people, we often don't give ourselves.
That is so true. And I liked that in your book when you sort of talk about that. And, it's hard in any situation, but especially if your child is facing a challenge, right? I think sometimes even harder in a way to give yourself grace. So when you're working with parents who might be, experience self-blame, sort of self-doubt, what are your sort of recommendations for being able to, feel better about how you're parenting when when you're in these hard situations?
Yes, a lot of times the trouble comes most when a child's challenge kind of like lines up with a parent's challenge. And this happens a lot for obvious reasons, like related to genetics, that like an anxious parent is more likely to have an anxious child, or a parent with dyslexia is more likely to have a child with dyslexia. And the parent is experiencing it through the lens of having lived through it, and lived through that it was hard, or that people were not supportive, or that that they may have really strong opinions about it. And that I think that additional layer of feeling that comes when your child inherits your challenge, it can be very difficult. But I think the first step to kind of moving past it is to name it, to say to like either a friend or your co-parent or your pediatrician, like, I feel really sad that she has this, just like I had growing up, if that's how you feel. Because I think it's okay to be sad or disappointed when your child is facing something hard. And it's normal, right? And so it doesn't mean you love them less. It doesn't mean that it's a terrible thing they're facing, but it's an appropriate emotional reaction. And sometimes like saying it out loud, talking about it, talking it through will make it feel less overwhelming. Because it's the kind of thing, it's like you give your children so many positive attributes by being their parent. You give them life, and they also got your smile, and they also got your sense of humor, and they have the privilege of living with you and growing with you and their siblings and all this beautiful stuff. And yeah, there's like some things that aren't always so easy about being us, but that's part of what makes us human, right? So
Totally. And, I think in, one of the stories in your book too, like when we were talking about the implicit versus explicit messages that you're sending and how you're receiving information around, I won't give it away, but the dad whose son has asthma, is sort of brings it home, like the way that you go through these sort of case studies, I guess, it would be a term to use, around sort of how you see this when you're facing a similar challenge or you faced a similar challenge to your child, but maybe their experience of that challenge is different than your experience of the challenge, and how you navigate that.
Yes. Yeah. That story comes up. Another one that comes up a lot is ADHD. A lot of adults, when their children get a diagnosis of ADHD, they kind of, in hindsight, or maybe even in adulthood, they put together that they might have had ADHD growing up. And then they also immediately go to, and I never got extra time or medicine or treatment for it, and then I'm okay, or maybe I'm not okay and I'm resentful that I never had that. But that's another example of the kind of situation of like, you bring whatever you lived through to your child's challenge. And so just kind of acknowledging the influence of that experience can be very informative to helping prepare and understand, and kind of choosing with intention the response you want to have for your child's challenge.
That intentionality, right? So important in parenting. Sorry, I have to say, I had to charge my computer because my teen is, like they have finals right now, and her computer was, she used mine and did not charge it. I just realized. So how would you say, being in this field, because you were, to give some maybe background to our viewers, you were also a pediatrician within the school system, right?
Mm-hmm.
How would you say that experience sort of has influenced how you work with parents and children, having sort of, because I love how your book takes this real like systems approach to a child's care and their experience. So, and school being so, such a huge part of children's lives and families' lives as well. Can you talk a little bit about sort of your experience being in the school system, and then how that helps you speak to parents about navigating the school system if their child has a challenge?
Yes, absolutely. So I used to, before I worked in the schools, I was working in an academic complex care clinic. And so what we did was we took care of children with really significant chronic conditions like transplants or prematurity or cerebral palsy who were technology dependent, feeding tubes and wheelchairs, that kind of thing. Those those children and their siblings who may or may not have had their own condition. And I have to say, in the environment I was in the Bronx, it was mostly a Medicaid population, a lot of families living in public housing and shelters. Rarely were they getting what they needed from the community, whether it was home nursing services or services through the school. And it was a little bit driving me crazy because there's only so much you can do in the clinics if your child's not getting, like if a child has cerebral palsy and has contractures in their leg, and they can get lots of procedures on it, but then if they're not followed up with physical therapy regularly, the child's going to have the pain recur in their leg. And that was part of what motivated me to take the job in the school system, to kind of like learn how the system worked, figure out where things were falling through the cracks, and like try to make it better to serve the needs of the children who are being impacted. And I learned a lot in that transition. And the program I was running at the schools in the South Bronx was really focused on asthma and diabetes because those conditions are so prevalent. And I think the first thing that I learned is that the schools were all very different. So even in the same district, all public schools, every front office looks different number of people working there, different job descriptions. In some schools, the secretary of the principal does the IEPs, in another school, there's another person. And so it just made me aware of how a parent is kind of responsible for navigating the school environment, and it's not always straightforward and easy. And it's in some ways it makes me like a little. This is part of what motivated me to write the book, right? Like it's hard. It's sad that parents have to do all this work, but it's a reminder that that the value a parent brings to their child's care when they successfully navigate the school environment to get the IEP. And it's not because the educators don't want what's best for the child; they absolutely do. But the staffing and the resource allocation, they might only have a speech therapist one day a week, and so they actually can't allow 100 kids from the school to get speech therapy because they only have 20 slots or whatever it may be. There are often limitations outside of their power, but I think the educators, I think I always think about it as sort of a triangle, right? The home, the hospitals or clinics where the pediatrician is, and the school, because it's like a partnership, and it has to be that way in order to support the children. Because sometimes I tell you, the school has, because they spend so much time with the child, they have invaluable observations about the child's behavior, the child's learning, the child's symptoms that might occur during the day. And they can partner with the parents and the pediatrician to provide treatment when needed. School nurses can do a lot of education, of giving medication. That's often like one of the tricks when a parent can't give the child a medicine regularly or do whatever care the child might need. We can always reach out and ask the school nurse for help, because often a school nurse can get a child to take medication a lot easier than a parent, because they just have this authority and this perspective and this experience doing it. So it's wonderful to know that the educators and the school nurse, they're partners in the care of the child. It's just that we have to learn how to communicate and find the right people so that the system will work the way it should.
So tricky. And, I think something that you touch on in your book too is this idea of sometimes being reticent to, excuse me, to tell a school if your child has a concern or an issue, because you don't want them stigmatized or treated differently, but really how it should be a partnership. And in order for the partnership to function well, everyone needs to sort of have all the information.
Mm-hmm. Yes. It's pretty funny. So when the COVID vaccines came out, a lot of people in my community reached out to me to ask for help getting their kids vaccinated. But I didn't realize that at first that the people who reached out to me the most frequently were the parents of needle phobic children who like felt like they couldn't bring them to CVS, right, to get the vaccine there because that in the store with like no time and no child friendly people, like it would just not happen. But the funny thing was that these parents were typically like friends in the neighborhood, and they wouldn't tell me about their child's needle phobia, right? So I'd like walk into the exam room and be like, "Hi, I got a shot. You're 10, right? No big deal." And then they would like proceed to freak out. And I think they didn't tell me because they didn't want me to say no or they didn't want to be judged for it. But like, yeah, sometimes children are needle phobic, and I'm not going to judge a parent or a child for that. But once I know, I can approach the situation totally differently. We can make a plan, we can talk about it, we can give them some choices and some prep work to make it go more smoothly. And I think that same perspective goes for the school. If you do have a child with behavioral difficulties or ADHD, or if you're concerned about your child's social skills, and the school can help if you let them, but you have to let them and communicate with them to facilitate that.
I think there's this, as a parent, even if you're in the field, sometimes there's this anxiety moment, right? Like you walk into the pediatrician and you're worried that your child's healthy, right? You walk into a parent teacher conference and you're like, oh, is everything going, as we want it to? And I feel like some of the barrier to that, right, is that you kind of don't want to provide any information that you think would not help, but as you say, it's so important in order for everybody to be on the same page. And there's no judgment, ideally, right? It's just like knowing how to approach the situation. But like so many things in parenting, it can be anxiety provoking, right?
Totally. And I think one piece of it that I've focused on a lot in talks like this because is that the parent is most alone sometimes when the symptoms are mild or it's uncertain. Sometimes when your child has like a moderate or a severe problem, often there's no hiding it. You're definitely going to talk about it. You're definitely going to get resources from the school and from the pediatrician. But it's those kids who they're a little quirky and their communication difficulties there, but like maybe it's just like their temperament or it's not really causing any impairment, and the parents end up doing so much worrying about when is the right time to say something, should you say something, should you get an evaluation, and I often fall into the camp of encouraging parents to do the evaluation sooner, because if you're to the point where like every week or every couple of weeks you're talking and debating this as a parent, what the evaluation can do is give you more data. It can give you a report from experts. The part of the IEP process is having a speech therapist meet with the child, and they can report back about the exact speech and language abilities they observe. You'll get some feedback from the school about that. Or if you needed to get more information from like a neuropsych, you can always get that information and then decide what to do with it. Doesn't mean, I think sometimes people associate investigating something like getting an evaluation with taking a step to get treatment or to label. And those are really like two separate steps. And so often getting the evaluation, either, for a mental health or an educational or developmental issue, even if it will help you decide if there is a problem that needs referral or treatment. You don't have to be like alone in assessing that, because that's actually a pretty complex thing to decide. And too often I see parents like trying to figure it out for themselves. It's like, no wonder it's like so hard to be a parent, because you feel like you have to do all the research to become a developmental expert on children and decide some really important thing for your child about whether or not they need more help. But you don't have to do that. You just have to ask for help and then, get the evaluation from the expert.
It's funny what you were saying just made me think of two things. One of which you talk about in your book, and that is there's often the parent because division of resources, right? Caregiver that sort of gets a lot of the information from physicians and therapists and sort of relays it to the other parent, and sort of how the roles both of those caregivers play, and the different strains and stressors on both of them. Can you talk a little bit more about that, and what to do if you feel like you're the parent fulfilling either of those sort of roles, right? So you're the researcher or the consumer.
Absolutely. Yeah, I definitely have had a lot of families. I mean, it's hard because every family is different, but sometimes there's one parent who's doing more of the maybe direct care with the child because one parent is working more. So that parent may be interacting with the school more at pickups and drop-offs. They may be overseeing play dates. They might be going to appointments. They might be doing more meal times or bedtimes. And because of that, they might be observing more data about whether or not a child's symptoms are a problem for the child. If the fact that the child has always been a worrier, is it not becoming into anxiety? They might have data about how they refuse to go into the new class after school, or how the teacher and the ballet teacher both brought up the shyness in the same week. And this data, because it's so much data, it's never going to be perfectly communicated to the other parent, who might be, either like home with the newborn or at work or whatever it is. So sometimes when there's a new diagnosis, there's a bit of catch up that has to happen for both parents to get on the same page. And I think because parents care so much about their children's health and well-being, it can become rather heated and emotional if one parent is sort of, asserting their opinion that the other parent is wrong, or that they disagree. So before you try to jump ahead to making decisions about, like, should we get an evaluation? Should we do something about this? The most important thing to do, especially if it starts to head in the decision of like, feels like we might be on a different page, is to level set on the data and to review, like to make sure everybody knows everything. Because sometimes what happens is that once both parents have the same information, they make the same conclusion, but it's that early stage of one parent having more knowledge about the situation than the other where there can be a lot of conflict. And it comes up all the time.
I can totally see that, because if you're, just the one maybe observing more behaviors, and you mention to the other parent, oh, well, yeah, maybe a little concerned about their attention, or, whatever, and the other parent hasn't seen all of those behaviors, it's almost like getting a diagnosis in a physician's office in a way, right? Where you're like, wait a minute, what's going on here? Like, I thought, everything was going sort of smoothly, and I feel a little bit taken off guard, right, by co-parent.
Yes, and a nurse is a strong force, right? So like sometimes you default to thinking everything's fine and you should just keep going with the same. And so to change course or to consider doing something difficult often feels hard if you don't really like see the justification. But I think part of it too is sometimes for something important, like starting a new medication or having a surgery, sometimes there's really no substitute for having the expert speak with the reluctant parent, because hearing it, you do a lot as maybe the default parent to convey information, but sometimes just hearing it directly from the source, their opinions and why, and having an opportunity to directly ask questions can be really valuable. So sometimes when there's a lot of conflict, sometimes I will recommend that, and I find it really helps to kind of just level set, like a family meeting or an extra appointment for them to discuss their concerns. Because if it's, especially if it's a more important decision for the child's care, having that extra discussion seems really worthwhile.
Definitely. And, I think something somewhat related to this is there's so much information out there right now, right? About parenting and medical conditions and all these different things. What would you say to parents to sort of, if they have a concern about their child, sort of how to navigate the social media, the, popular press world, and how to, find valid and reliable information, and then when to say, okay, I need to go and talk to somebody, a professional in the field, versus sort of this self-diagnosing.
Yeah, I have to say, I think the self-diagnosing is getting just a wee bit out of hand. It's hard because I'm all for like empowered parents who have access to good information. Um, but I feel like it puts a big burden on parents um, to not have trust in the other people around them in some regards, because it comes up a lot with babies and milestones, for example. Part of the reasons that we see children 9 times that first year as pediatricians is it's our job to help identify children who are having developmental delays so that we can promptly intervene by referring them and getting them therapies like physical therapy. But the internet would have you think that if you don't do it as a parent, like monitor the milestones and do the curated activities suggested, that nobody else is going to provide that care. And so that's like, that's not true. So I think it's good to be thoughtful about how you spend your time doing research, because what happens, I think, is we want to say your child has a new diagnosis like asthma, and so you want to be like an instant expert and you just start Googling and Googling and Googling. But if your child has asthma and you've decided you're going to maybe see a pulmonologist about it, rather than trying to become an expert on all that there is to know about asthma, maybe that first week your research would be better spent picking the best local doctor that has the best reviews or that your friends have seen, and finding that ally that you can trust to see your child, because that takes time too. So whether you're going to invest the time in becoming an expert or in finding the best expert, you see there's like a little thoughtful division. So we want to use our research time purposefully for the most benefit of our child. And sometimes it's not always, it's curating the best resources rather than becoming an expert in a diagnosis.
That's such a good point, because right, there's limited time, and finding the right person can take a lot of time too. So
Yeah.
that's the most important aspect often in care, right? So I'm just curious, we're sort of, coming towards the end, but so you speak about this in your book, and your advice I give my friends, your Instagram is so great. But just like the social networks that parents, can you speak a little bit about the importance of those social networks and how maybe you can find a social network if your child has somewhat of a complex or not complex, care concern?
Yes. I think it can be very isolating when your child has anything other than totally normal development, totally typical development, because you may not know anyone offhand who is dealing with the same thing, and you may have less time for being social, for going to the playground or play dates or whatever to make more friends. But it's just so important to have that community and that network. And so I do think that in-person connections have value, but I think that social media can be a pretty close second, because it's more accessible. Being in a WhatsApp group or a Facebook group can allow you to really like reach people and have frequent contact with them in a really nice way. So the question is like, how do you find your people? And I think one of the most important parts of that is like making it a priority, or naming that it's something important to you. Because sometimes I talk with parents who find that it's making their lives worse not to have a social support group. And it's kind of like, so what have you done about it? Have you tried joining any Facebook groups, or going to anything, or introducing yourself to anybody? And then often we're like, no. Like, so it's just that when you have something that's important to you, even if it's kind of an abstract thing like making mom friends, making like it on your to-do list like a priority, because often we put all our kids stuff first, and we put our friends, mom friends, or finding a support community for parenting our children kind of on the back burner because we're so busy and focused on the kids. But it will enhance our endurance as caregiving parents to have that support network, and it will help us cope with stress, and it will help us like find better resources for our children. So I think it's really time well spent to invest in, sending more messages, having coffee with somebody. These sorts of things that might seem frivolous can actually be quite valuable.
Yeah, I think that's so important, right? Like at first, sometimes it feels like you're putting yourself ahead of your child when you do this, because of, I think, more maybe our generation than younger generations, but just that idea of you're actually really helping your child by being at a place that you can help them co-regulate, that you can listen to, sort of what they're feeling. And a lot of that comes from having your own social connections. It's not just a about me thing, right? To have these friends and spend time on those relationships.
Yeah, and I also find that sometimes we assume that other people won't get it. So like, if all the other babies seem very happy and my baby is very fussy because they have milk protein allergy and reflux and they're fussy all the time, I will assume that those people just can't relate to what I'm going through. But the truth is that like a lot of people have gone through hard things, and sometimes are going through hard things, and it might not be visible. So sometimes until you kind of or open up about how things are hard, you may not realize that things are hard for other people, even if it might be for a different reason. They can still relate.
Yeah, totally. Well, something that we like to talk about sometimes at the end is thinking about, and you talk about this in your book, but being in the field, being in child development pediatrician, and then being a mom, sort of how do you find that each has influenced the other?
Yes, it's interesting. I definitely think I've learned a lot from being a mom that I didn't learn in my training to be a pediatrician. Like, that's part of what inspired the Instagram account Advice I Give My Friends, because um, I found that the questions that people ask me most as a friend are things that are sort of gaps where doctors don't necessarily consider it like part of, like it's not a core focus of the academic study, how to get your kid to sleep or how to stop a tantrum, because these are like pain points for parents, but not necessarily medical problems. Um, so I definitely have learned a lot about what matters to parents through the experience of getting my own kids through childhood. Um, it's funny to think, I, I don't think, maybe I just take it for granted. I don't think being a pediatrician has really impacted my kids so much. Although it's funny, the dynamic in my family is that I'm always like assuming they're fine. And my husband has to be like, no, like she's sick. And I'm like, she's fine. So if
I thought
anything,
that
I'm
was
like
funny
less
when I read
worried than normal.
that. That's probably a benefit though, in a way, right? Like, they have your relaxed sort of perspective as well as
Yes.
just Well, this has been so lovely, so nice to talk with you, get your perspective on these things. I know folks who, watch this, listen to it will want to know more about where they can find information about you and your book and your Instagram. So if you just can provide some of that, that would be great.
Yes, totally. So I am at Advice I Give My Friends on Instagram and Facebook, and I have my book right here, Advanced Parenting. It should be hopefully in bookstores and libraries and anywhere where you get your books. There's an Audible book too, and you can find links on my website, kellyfradinmd.com.
Great. Thank you. And if you're interested in Cooper, we're at your_Cooper on Instagram. And we're also online at beta.cooper.com. So thank you all for joining us tonight, and hope to talk to you soon.
All right. Thank you so much.
Thank you.